Now, before we do, I just want to acknowledge Thorne Harbour Health acknowledges the traditional owners of the land on which we're all joining this event from tonight. I know that people are spread out across the lands of many First Nations people, and we want to pay our respects to elders past, present, and emerging. And I want to further acknowledge that sovereignty was never ceded, and I want to acknowledge the First Nations people joining us tonight. I also want to acknowledge those elders from our LGBTI and PLHIV communities joining us tonight, as tonight's panel and a lot of the history series that I've worked on before certainly take a look back and reflect on their legacy. And I acknowledge as a, I guess, younger gay man that I greatly benefit from the efforts and the work of the generations that came before me. Without further ado, I want to acknowledge some of those joining us on the panel tonight. Annie Bev Greet is a longstanding member of the Victorian AIDS Council and now Thorne Harbour Health, in fact, is a life member, and was integral to the establishment of Positive Women Victoria back in, I think it's 1988. Have I got that right, Bev?
Well,
and Bev has been a leader in the Aboriginal community's response to HIV in both Victoria and nationally. Bev has launched our reconciliation action plan here at Thorne Harbour and is a member of both Victorian AIDS Council, now Thorne Harbour Health's Aboriginal Community Advisory Group, the MIPA Committee. I believe you were involved in pretty much the formation of every national HIV
and
AIDS
international,
including NAPWA, as you said, co-founder of Positive Women Victoria, and the list goes on. Dr. Edwina Wright is an infectious diseases physician specializing in HIV clinical care and research. She's based at the Alfred Hospital, Central Clinical School, Monash University, and has honorary affiliations with the Burnett Institute and the Peter Doherty Institute. She's been looking after people living with HIV for 35 years now. And I know she's, for those people that have heard us before on regular guest there, as she's leading the way in a lot of the PrEP research that we've been undertaking here. So thank you for joining us as well. Maureen O'Brien. Now, Maureen is actually one of two panelists I had first the pleasure of meeting during the 35th anniversary of Thorne Harbour Health as we did the series looking at the legacy back in 2018. Now, Maureen started as the then Victorian AIDS Council Gay Men's Health Center in 1987 as a community health nurse. She worked there as a nurse and counselor for 8 years and was part of setting up the center clinic at each of the sites when we were operating from primarily Johnston Street in Collingwood and later Ackland Street in St. Kilda. Maureen O'Brien, the center clinic, is moving once again into the Victorian Pride Center in the month ahead. So it's lived on that legacy. The other guest that joined me for the VAC Legacy series a few years ago on Well was Sue Stone. Sue Stone qualified as a social worker in the early 1980s. She's a background in working with people in aged care as well as those with chronic health conditions and life-threatening illnesses. In 1988, she began working at Fairfield Hospital as a social worker supporting patients who had HIV and AIDS. And after being at Fairfield for 18 months, she went on to become the manager of counseling, welfare, advocacy service, and medical clinic at the Victorian AIDS Council Gay Men's Health Center. Sue worked at the Victorian AIDS Council for 3 years, and then next position was from 1992 to 2000 was at the Alfred Hospital, where she provided counseling and casework services to people living with HIV, their friends, and family. And so thank you again for joining us, Sue, as well. And last but certainly not least, Crock. I believe Liz has joined the ranks alongside Bev and a few others there as a life member of the Victorian AIDS Council quite recently. But Liz is also a HIV nurse practitioner working at Bolton Clarke, formerly the Royal District Nursing Service HIV program. She's worked in HIV for 30 years at the Alfred Hospital, Fairfield Infectious Diseases Hospital, and the Royal District Nurses Service. And she has a PhD in nursing ethics and HIV and is the president of, I'm just gonna spell it out because I think that acronym is a long one, the Australian and New Zealand Association of Nurses in AIDS Care. Liz is a strong advocate for the longstanding partnership between Thorne Harbour Health and Bolton Clarke for the care of people living with HIV in the community, and that's a partnership that is strong and still going on to this day. So thank you to all 5 of my panelists for joining me tonight. I guess I'm gonna do a bit of a whip around here because I imagine it's a very different experience for each of you. But how did you first get involved in the response to HIV and AIDS? And I'm happy for any of you to start. I don't know who might have been involved with the organization first, but who would like to pick up that one?
I'll pick it up.
Sure.
How I became involved was I was diagnosed in 1984, the first woman to be diagnosed HIV positive at Fairfield Hospital in Victoria. And was there another part to that question? No.
Well, I guess, yeah, how you first got involved. Yeah.
From there, I looked around for, apart from being in shock and thinking I couldn't have any more children, I looked around for a group, and there was a all gay men's group. It started up in 1985. So I joined that as the only woman, and that was really good and interesting, and at least I felt. And at the same time, I would look for to meet another positive woman, which I didn't meet for another 4 years. But that's how I got involved.
Thanks for that, Bev. Anyone else want to jump in on that one?
Maureen.
Maureen, you go for it.
Yeah.
I joined VAC and the Gay Men's Health Centre as a nurse when things were just getting started in any organised way. And I really didn't know what I was getting myself in for, if I'm really honest. And I remember the way I learned about HIV initially was to go to some gay friends and ask them, about it. And a very good friend of mine, Ralph McLean, gave me back copies of Outrage to read about HIV. And so I started really not knowing very much at all, excepting I'd come through student politics at Melbourne Uni and knew people like Warren Talbot, Alan Huff, knew of Phil Carswell, and people like that who I really respected and knew as really gay activists more than anything else. And so that's how I got started in it. And my learning curve was very steep in the beginning, but it was a really good 8 years for me. It sounds awful to say that, but it was. It was a good experience on many, many fronts.
Thanks for that, Maureen. Who wanted to jump in there next? Sue, did you want to take that?
Yeah, I was. I had a number of gay friends in the early days. Had a number of gay friends, but they weren't particularly sort of political, but became obviously aware through the media of what was going on. And I was at the time working at Peter Mac, the Cancer Institute, and I was talking with a colleague, and she said to me, she had a friend, Jan Watson, who was the manager, the head of social work at Fairfield Hospital. And I said, what's going on? Tell me what it's like. Tell me. And she said, look, her caseload is it's gone from a few people to it's massive. And I said, and she's the only person doing it. And I said, are they applying for funding? What are they doing? And so I said, look, I want to put my hand up. Can you talk to Jan, see whether she'd be prepared to talk to me? Because working with people with life-threatening illnesses, chronic conditions, I felt that I had kind of a grip on what I could actually offer. And so as a result, Jan rang me. They'd just received funding, and we had a very informal, it never happened now, a very informal interview with her, and I was given the job. Yeah, and like Maureen, then I had a very steep learning curve to find out what was going on, and so that was sort of 1988. But I first started making kind of noises, I guess, in 1987 about wanting to be involved. And part of it was that I had a friend who, not a close friend, but somebody that I knew, and he was talking about having cancer, and I said to him one day, pardon me if I'm being rude, but if you had HIV, would you tell me? And he said, oh, yes, I'd tell you. Of course, he didn't, and he died sometime later. So I kind of just felt that I wanted to do something, be involved. So that's where I come from.
Thanks for that, Sue. Liz, did you want to go next?
Yeah, sure. Yeah, before I did nursing, I was actually studied immunology as part of a science degree. And then when the epidemic started, I was in Italy and I was working in an immunology lab, and we started doing testing for what they called then HTLV3. And that was like the first I ever heard of it was there, and it was never associated with gay men or men who have sex with men over there. It was amongst injecting drug users in the small town that I was living in. Anyway, I came back from Italy in '87, and then I started doing nursing at the Alfred just because I thought I needed something practical to do. And I spent quite a bit of time on the infectious disease ward. So at that time, a lot of people were there on Ward 7C at the Alfred. And then I did postgraduate study at Fairfield Hospital because I just felt very drawn to doing further study in infectious diseases. So I went to Fairfield Hospital, and so that was in 1990, end of 1990, and ended up on the HIV wards there. And that was where also I got to know people coming into the ward from Victorian AIDS Council and the volunteers coming in, and I think they were called client support officers, the CSOs. And yeah, I just really took an interest and started becoming a bit of an activist through that.
Thanks for that. Edwina, that leaves you.
Yeah, thank you. So I got involved as a young intern at Westmead Hospital. I had lived in Sydney for quite some time, although I originally came from Melbourne and studied medicine in Sydney, and did my internship and my early training years at Westmead Hospital. And it was in that setting, doing a rotation through the infectious diseases unit, that I first met a person living with HIV. I remember it really clearly. I was asked to go down and see him in the emergency department, and he was extremely short of breath. And of course he had PCP, or what we call PJP now. And he was actually a man who'd acquired it through blood product transfusion. And somewhat interestingly, when I ended up coming back to Melbourne and ended up first at Fairfield, then the Alfred. But when I went to the Alfred, a year after I got there, I was invited to come and look after all the people with haemophilia who had HIV. So that link was sort of somehow there in the universe, many years before I did that. But yeah, I have very clear memories of gay, bisexual men, men injecting women up there at Westmead, and it was really in that medical context that I first, literally face to face, started working in the area of HIV.
Thanks for that. That kind of starts to teeter into my next question for everyone, which is, when you think back on the early years in responding to the epidemic, and there was a lot at play because it was, we were just seeing a disease that largely affected, gay men. And this was just hot on the heels of gay and lesbian liberation and the decriminalization here in Victoria, which we're celebrating, I think, 40 years of at the moment. There was a lot of factors, I guess, at play during that time. But when you think back on those early years, what stands out to you from that time?
Oh, the shocking stigma.
Yeah.
Yeah, and discrimination. The way that people were treated, the way that people felt, like my friend who felt that he had to be secretive. People felt that they had to be secretive. It was really, that was, certainly a feature for quite a long time, where people felt that they couldn't share it with people. And if they mistakenly, not to say mistakenly, people that actually did tell people often found that they had a shocking response, and families and some friends were fearful, and often it was the double whammy of not only am I gay, but I'm HIV infected as well. So I think that was a big feature, and Maureen would have been dealing with that very much, because you were there earlier than I was. Is that your kind of memory?
Yes, certainly, Sue. I think for me, what stands out was it was such a tumultuous time that on every level, people were dealing with things that they'd never had to deal with before. And I remember the debates around testing, whether people should be tested or not, and VAC, and I'll refer to it as VAC because that's
what it was.
And I remember the debates that went on about every single thing, which I found was fantastic because there was so many good people leading these debates around testing and how we would provide the safe sex message, and going out to beats and things like that, and everything was debated vigorously in the staff room, in corridors and things like that. And there was no blueprint to tell us what to do. We just had to feel our way. And we had great leadership from people like Adam Carr and Phil Carswell, and people like that who, read widely, researched, and spoke to people in the United States who've been doing things from a community perspective. But a lot of the time for me, it was just such an unknown territory for all of us, for the clients, for their families, for their community, and we just had to keep debating things and trying to come up with the right answer. And at the same time, when we were doing all of this, people were getting sick, and the people that were getting sick were staff members, friends, lovers, things like that. So there was so many complex levels to what was happening to us as a group, as a community. And I think what stood out for me the most was that there was no blueprint, because nobody had done it before, in my experience, and all of our experience, I think. And it was a really very difficult time, but I think that's what stands out the most for me. Yeah.
Did anyone else want to add to that?
Yeah, I do. I just wanted to say, I was a primary school teacher at the time when I was diagnosed, and it was around the time that Eva Van Gerst was, dismissed from school because she was HIV positive. And I'd be sitting in the staff room with fellow teachers, and the discussions would be, oh, we should round them all up and put them on an island. And I had to try and keep my mouth, not show that I'm nuts about. Certainly I defended people who were HIV, but I didn't want them saying, well, how come you know all this, what's your knowledge of? And I also felt I couldn't tell the principal, because then the principal would then tell the parents committee, and then the parents committee would race in and grab their children, from me. So from that, I actually resigned from teaching and continued to do my, in order that I could do more voluntary work around positive women. Yeah. And those scary Grim Reaper things, they were pretty scary.
I was going to say, Caleb, a few things for me was just, I guess, how incredibly sick the patients were coming into, let's say, if we go to Fairfield Hospital, which is sort of in many ways still feels like my home. How incredibly sick they were, and how incredibly brave they were, these young men, just so brave dealing with these illnesses. The dedication of the staff, people like Liz and my other colleagues there, and also the stigma from family members. So, you know, some young men died there with parents refusing to see them even, you know, prior to their death. You know, unthinkable really. And that must have been agonizing for those young people. But I also, in a way, feel for the parents, because they had those parents who did that because they would have kept living and begun to understand more about HIV in the world, hopefully, and understood what a terrible thing they'd done to their child. And that would be, as a parent, I think, a real suffering to have done that. So I'll never forget that, a father not coming to see his son die and would refuse to visit him at all. And so I think, you know, the average sort of middle class, you know, white heterosexual Australian, they're just not going to meet that sort of treatment most of the throughout a lifetime here, of that sort of level of terrible discrimination. Yeah.
Thanks for that.
Yeah.
Go ahead, Liz.
Yeah, I was just going to add, I mean, similar to what everyone said, but what really struck me when I first arrived at Fairfield was the, you know, complex ethical issues and the intensity of those issues that people were having to deal with every day. So whether it was the patients themselves and their families, but it just really heightened every single ethical issue. So whether it was around confidentiality, you know, which is a well-known ethical medical issue, you know, it's always been a principle, but it was just like so much more intense, and you had to be so much more careful and develop, you know, specific policies around, you know, who knows that person's diagnosis, who can you tell? And, you know, there became this whole culture around, you know, this very extreme sensitivity to all of those issues and how we could best protect the patients, and, you know, informed consent for testing, as Maureen was talking about, you know, dealing with end of life decisions with young people that were in effect like mostly our age and without their families around quite often. And it just really sort of highlighted the connections that, you know, you need to protect human rights to be able to protect public health. So, and I think that all of those things have really come out over the years, and we can see now, you know, with COVID pandemic happening, all of those much sort of tighter principles and have really been strengthened by HIV. And that was something that really struck me during those times.
I remember, Liz, when we had to try, and we were allowed to, but you could use a special code on a patient's death certificate, so that the family, who was so anxious to see the certificate to really find out what they had, they couldn't fathom it. Even then, we wouldn't tell them. So it was, you're so right, Liz. It was a really amazing place to begin to deeply grasp at a highly intuitive, experiential level that the practice of ethics. You're so right. That's such an astute observation.
I wanted to ask actually all of you this, I suppose, is a bit of a question without notice, but over the last year, obviously we've been all taken by the COVID-19 pandemic. And has that, I guess, I don't want to say triggered, but has that prompted any thoughts about having been involved in responding to an earlier epidemic in your lives?
Yep. Do you feel like you've been living through two epidemics now? Well, I do, you know, and so in a way that sort of gives you greater strength because you've been through it before. I mean, I know it's different in the way of lockdowns and all of that, but it did give you, well, gave me and many others strength in, well, I've survived one.
Here we go again.
I'm going to survive this one.
Yeah.
Caleb, I did a talk last year, sort of the Australian story, HIV, the Australian story, like it's 4 decades this year since it was discovered. And to do that, I looked back to see how well prepared we were in 1981 for this pandemic. And so I went back and looked at all the pandemics during the 20th century, like TB, cholera, Asian flu, even the plague, and none of them, and neither is COVID, was a sexually transmitted pandemic. So I agree. I think we sort of understood how the science would help and stigma would be such a big path, but still HIV stands alone in having been predominantly sexually transmitted pandemic. And it's going to be really interesting to see how well we're prepared for the next sexually transmitted pandemic. Yeah.
That's fascinating. It's an excellent point. Unless anybody else had anything to add to that one, I wanted to ask you the next question, which was, do you recall many other women being involved in the response in those early days?
Yeah. I made a list.
Did you, Sue?
I did. Well, because there are other people will remember, but can I just sort of flip through it quickly? Name some names.
Sure.
So feel free to Jan Watson, who was the senior social worker at Fairfield, and I think was coping with, her caseload went from 1 to however many. She was there and working on her own for quite a long time. Anne Mitch, of course. Tess Slater, who used to run outpatients at Fairfield Hospital. Tess was amazing. Beth Thompson, AHAG, who was was involved in AIDS Housing Action Group. Julian Carey, who used to volunteer and do things around VAC. The support workers, Robin, Helen, Suze McLean, our fabulous receptionist at VAC, Joan Golding, and Beth, whose surname I can't remember, it's Sexual Health. So that was just me jotting those. Hatch, that's right. Couldn't think of it. Thank you. So those were just a few that I could remember, and the countless volunteers whose names I don't know.
Oh, we've even had in the Q&A here, someone said Sister Hilda.
Oh, yes, Sister Hilda. Yes, God, I shouldn't forget.
And Sister Greta.
Yep.
It was very helpful. And to me, Dr. Anne Mitch was an angel.
Yeah.
And had a lot of, women saw her, and everyone felt so supported by her, I'd also like to mention Elizabeth Taylor, who set up AMFAR in the United States for the research. And
Deb.
Yeah, and Elizabeth Reeve, working for the Commonwealth, she helped me in supporting me to go to one of the international AIDS conferences in Vancouver. And of course, Beth Hatch, as you said, I had a few other names, but there were lots of good women that were supporting the supporters all. And mainly a lot of good nurses.
Fabulous nurses. Yeah.
Fabulous. Thank you, Liz.
Thanks, Bev. Yvonne Gardner.
Oh, go on. Sorry, Liz.
Yeah, I was just remembering Yvonne Gardner, who passed away about 2 years ago, who used to hold the Friday lunches for positive people.
Yes.
Yeah.
Yvonne Gardner.
I had a few names, Caleb.
By means.
Well, of course, Anne Mitch has been mentioned. Jenny Hoy and Suzanne Crowe, who was both at Fairfield and Burnett as a clinician and a basic scientist. You might remember Elizabeth Dax at the National Reference Laboratory here in Melbourne. She was so pivotal in looking at all the different HIV diagnostic tests and running them against each other and making sure, doing the quality assurance for those. Back at Fairfield, as people probably remember, it was situated literally alongside Vidrell and Macfarlane Burnett. So you had scientists across just a walkway, and one of them was Sue Land, who did a lot of the very early basic science on HIV. They'd culture HIV, then they'd expose the virus to different antiretrovirals to see if it was sensitive. So that was a long time ago in the 90s. Remembering, of course, Lavinia Crooks from Ascham. She was involved so early in the response. My nursing colleagues, Liz Crock, I very well remember working with Liz in Ward 4, and Jo Lucas, who remains an extremely dear friend, was a very important nurse at Fairfield. And Bev was also very important to us doctors, especially younger doctor like me, understanding, what a person living with HIV, who they were, what they represented, what they can bring to a situation, how much they have to teach you. So we learnt a lot from you, Bev, a lot. And so they were really key women for me as a younger doctor, and getting older as well. A lot of those women have remained in my life.
And I also think, Ida Buttrose did a lot of good work and really sort of, talked to mainstream in Australia. So that was incredibly great in raising the profile that, and trying to reduce the discrimination.
That's an interesting point, because we did have a comment here in the live chat that someone said, that they cited Diana, Princess of Wales, because there was that moment where she was shaking hands without gloves while visiting a patient, and that played a really important role. It's interesting because I know a colleague of mine still has a picture of that news clipping on his desk. Because yeah, you're right. So there were women like that who had particularly high public profiles on the international stage that's made some differences as well. I guess kind of a follow-up to that, being that at least here in Australia, it was largely affecting men who had sex with men and gay men. Did you feel like there was ever, I don't know if if you ever felt like an outsider, or that you had to navigate a boundary with a community that was being so heavily affected by this, but not being gay men yourselves? Was that ever a part of your mentality while navigating this?
I think we were pretty. We'll probably all say something different to this question.
Yeah.
I think that we were really well accepted, and like we were sort of welcomed into their community. And it was a real eye-opener for us, a lot of it, but yeah, we were taken into trust, I'd say, by the gay community. I don't know, someone else say something.
Yes, I agree with you. I felt embraced from the beginning as part of it. And I think there was always respect for you as a nurse, as for me, my situation. But also, you build relationships over time. And, I was saying before, working at VAC, there was volunteers and staff and clients, and there was so many crossovers. So I certainly never felt like an outsider or anything like that. It was quite the opposite, actually. That people, gay men, because primarily it was gay men, wanted you as part of it and respected the work you did. And, the friends that you formed through that, I'm still friends with many people through that time. So it never, ever did I feel an outsider at all.
And that's absolutely true for me. It just never sort of raised its head. I mean, sometimes you'd have disagreements about things because...
Oh, go on, Sue.
But they were all open. What would Chris Gill describe it as? We'd have an open and frank discussion.
Yeah.
Fairly open and frank discussion. So, but it was never, possibly with the exception of one person I can think of, who shall remain nameless, just always felt that we were part of the game. We're sort of part. It was like a game, and we would just, there would be disagreements within the organisation, but not necessarily along gender lines. And if ever anything happened and there was an attack from the outside, like after the famous two boys kissing, everybody just came together. Even people that, you didn't necessarily get on very well with, but we would all, it was like, no, it's us against them. Would happen from time to time. But yeah, we would have frank discussions from time to time, but they were never acrimonious, I don't think. They might be heated, but they were never acrimonious.
Bev, I want to ask you about that, because as a person living with HIV yourself, I imagine that was difficult.
It was very difficult, in fact. We were sort of a minority within a minority. We were invisible. We were seen as vectors of disease, and I remember, knocking on the health department's door and saying, we need independent funding, for women. And told there weren't enough of you. What's the magic number? Does there have to be to, get independent funding, and the importance of women being supported by each other in the true peer support model. So that was hard. We didn't get funding till I think about 91, 92, and then we got the Matron's College at Fairfield Hospital. So we were up and running, and then we could have, either the positive women could visit us at the Matron's College, or we could go up and visit them if they were ill. But, and also there was some, thoughts that positive women were just jumping on the bandwagon sort of thing, and so we did. I think positive women in the early days felt very isolated, and we were working out of each other's homes, and people would need to bring us at home and that. So we felt a little bit on the outside. Yeah.
Edwina, I wanted to ask you, because I know you're still, you've kind of navigated the epidemic, and I know you've been, really getting to know a whole new generation of gay men with the introduction of PrEP and really an age of biomedical prevention. How have you felt navigating that?
Well, yeah, I guess it's happened over a long period of time. So we adapt. One amazing thing about humans, because technically we actually never know what's going to happen in the next minute of our lives. We've got a good guess, but you actually never know. We're incredibly good at adapting. So I think that I suppose it's still a bit of a shock that it's taken this long to get, for example, PrEP up and running, and a real thing, and like a tangible thing you can just go out and get and do and stop getting infected with HIV. That's taken a really long time. And also that, we don't have a cure, and we didn't know at the beginning how complex this virus was, the genius, if you like, of this virus in staying in humans and not being curable. So I guess there's a part of me which is still, looking back going, boy, what a ride, and it's still incredible. So I'm tremendously heartened by the newer technologies for prevention. They're just fantastic that are coming, injectable PrEP, injectable treatment, which will be really good for some people and not others. And it's certainly one thing I've noticed, and I'm very glad about, is the blossoming of choice for individuals to use different types of treatment and prevention. And especially in our country, where the PBS is extremely good at making choices available. In other Commonwealth countries, you may not have the same range of remarkable treatments and choices. So we should have to remember how fortunate we are. But I still think it's awful and dreadful, the level of stigma I think that is still there, and that is experienced by people who are gay and people who are HIV. And that's one thing that would be an amazing legacy for us to have really reduced stigma about both the viral infection and the way one chooses to be sexually intimate with other people. Yeah.
That's a great point, and that's something I would like to ask the group. You know, Edwina, as you rightly pointed out, this year marks really 4 decades in responding to HIV in this country. And I guess I want to ask the broader group as well, are you surprised by where we are today? And, you know, where did you think we might have been 40 years later, as we are now?
I might just come in with a personal experience. I was up until recently working as a social worker in children's mental health, and a mother came in, and she was HIV positive, and her child wasn't. And what surprised me, well, not surprised me, but what it marked for me was such a difference in how they were accepted, how, you know, treatment proceeded, people understood precautions, but there wasn't any stigma or anything like that. And I just remembered thinking, gosh, this wouldn't have happened 30, 35 years ago. It just wouldn't have been like that. Women and children, Bev touched on it before, you know, women, HIV positive women having children, and how that would all unfold. And what I was pleased about was my team just taking it in their stride and not having the same enormously less degree of anxiety than there would have been 35 years ago. And that's what made me think, gosh, this is such a contrast to what I experienced when I was a nurse and working, and all the fears for women about children and that sort of thing. So it's just a personal story, but it really did come home to me how very different things are now in that instance.
Thanks for that, Maureen. Anyone else want to jump in on that one?
Well, if things had been different, like if there are no treatments, would all positive people be dead by now?
Yes.
So, you know, I really appreciate, I feel very grateful and very, grateful that I reached the grand old age of 70. I've spent more than half my life with HIV. I have grandchildren. I'm married to a HIV positive man for 30 years. And I just feel really, as I said, grateful. And in part, it's because of the treatments that came in time for people like me. Yeah. I really feel for the people that died just before the treatments were available.
Yeah.
Did anyone else want to add or have a different perception of where you thought we might have been in 40 years down the track?
I don't know that I ever thought about where it would be, but certainly what people were saying is there will come a day when it will be treated like possibly diabetes.
Yeah.
You know, and that's, you know, I've got a friend who takes 1 tablet a day. It's bizarre. You know, it's just 1 tablet a day. So, and I've been out of touch with it for quite a while, except for this particular friend. But it seemed remarkable. But I believed it when I was told, you know, when they said this will happen, because it's, you know, as Edwina said, it's such a genius of a virus. It just mutated, and so there was this feeling of, can that really be? And here it is, you know, a long time afterwards. And the sense when I do look back, which isn't, you know, it's only times like this, of seeing all those young men that Edwina talked about, seeing people that were so ravaged before they died, it just seemed such a, you know, and I think some people felt it was a punishment, and after the years of just coming out, people are having a really good time, and then bang, along comes HIV, and it kind of seems shockingly unfair, really. But that's, you know, that's how it was. So yeah, I'm just pleased and grateful that people are not suffering as they were so long ago. And are you still? I mean, clearly, Edwina says that people are still experiencing stigma.
Yes, I can't believe that it was only 2 years ago I was seeing a physiotherapist at a hospital, and you know, I'd filled out the form. I had HIV, and I was diagnosed in 1984. And she said to me, "How did you get it?" I thought, you know, of course I said, "Well, this is an irrelevant question, really, you know." And she said, "Oh, the only reason I asked was so early, I thought you might have been one of the innocent ones through blood transfusion." Right. So there is still that stigma. This was only 2 years ago. There's still that stigma around.
Yeah.
Do you think we're seeing
And I
progress?
think, like, in my experience, oh, sorry.
Oh, sorry. Go ahead, Liz. You please, by all means, please do.
Can't hear you, Liz.
You've gone quiet.
Liz, yeah.
There you go. Oh, we've lost you there for a second, Liz.
Oh,
Oh, there
can
you
you
are.
hear me
You're
now?
back. You're back with us.
Yeah.
Sorry. I was just going to say, I think, you know, the U equals U message, undetectable equals untransmissible, has gone a long way in helping many people come to terms with living with HIV and not feeling like, you know, HIV defines them. But there's still far too many, I think, who do feel that stigma. And, you know, in our work now, we even now still get people that are diagnosed very late, or that just aren't taking their treatment, you know, sort of in denial about it, and or, you know, don't want to tell their family. And in the last couple of years, we've had, I'd say, several deaths of people from HIV-related illnesses that wouldn't have needed to die if they you know, managed to take their treatment and stay on it. So it's still happening, and it's still there, and especially in some minority communities where that stigma is really still a big issue.
Yeah.
Thanks for that, Liz. I wanted to get back to, and we've kind of already touched on this to some extent, but do you think anything in your experience in responding to HIV and AIDS has been unique? And this will, I imagine this will be quite different amongst each of you, but what has the experience been like for you as a woman in responding to HIV and AIDS in a country where, you know, majority of people being diagnosed were gay men? You know, do you think you brought a unique perspective, or how did that affect your point of view? I mean, we'll start with you, Bev, obviously, as the woman who's, you know, been living with HIV for more than half of your life, which is a remarkable one, and we're so very glad you are here. You know, 70 years on. But yeah, I guess what was that like for you? I guess from an experiential standpoint.
Well, there was always a constant threat of, you know, maybe we should merge. The government didn't really want to fund separate organisations, and why couldn't we merge? So we always had to continue to say it was very important to have a voice, to have a seat at the table. And that largely, it has happened now, but still there were many years where it was just the token woman on the board, or the token woman on some other AIDS thing. So I like to think that that's not so much, but still there is that element of being, well, I don't know. You're not really. I mean, you are positive, but you're not really, sort of thing. Like many years ago, I had a very good friend soon after I was diagnosed bring her own cup to my house. And I said, "What are you bringing your own cup for?" She said, "Well, you can get it. You can get HIV by sharing cups." I said, "Well, no, you can't." And I had to give her a whole education session on that. And I said, "But if you want to drink out of your cup, go for it, but you certainly can't get it." But no. So luckily, a lot of those myths over many years have now disappeared, like mosquitoes and cups and stuff. But there is some element there. I mean, I don't think you need to tell. I mean, pretty much I'm as out as you could be, But in the early days, there were so few of us women, or first of all, few of us positive, but fewer again that were prepared to be out, either talking to the media or being on a board, or out of the fear of their confidentiality being breached. The third woman that joined our group way back in '88, she was overheard by her boss about going to the next meeting or something, and she got the sack immediately. And we lost her. She didn't come back because she was scared that that could happen. So I don't know whether it's really answering your question. I can go off onto tangents every now and then.
That's all right, Bev. Actually, we've had a comment here come through the Q&A that said, "Bev, please write down your stories." So there's people that want to hear about those, and those have those memories there recorded, because
Well, I am currently writing my memoir.
Oh, very good.
Yeah, it's a happening. I've done very well, and I'm actually handwriting it, believe it or not.
Oh no, that's preferable.
So I haven't got technology in the middle, between me and
I guess for the broader group as well, I mean, it's still a very live discussion around, gender inequity in workplaces and, the divide there. So, working in the field, how did being a woman in that response factor in for any of you? Did it factor in for you?
It didn't.
It didn't for you, Sid?
Well, I've been around males all my life. I grew up with two brothers. I then was living with my partner and two sons. So I've always been around blokes, and I had a number of gay friends. So I'm kind of used to blokes, and it's it's not something that I really think about. So I think sometimes Maureen, you and I and Ruth would sometimes go into a bit of a huddle and say, I can't remember, and it's probably better that I don't, but we'd have discussions about like, oh, do you believe these guys? Like, you would occasionally turn to another woman and sort of roll your eyes about something. But I just think that's the nature of the work. But I never felt like it sort of, we've come full circle. I just felt like I was part of it. And it was kind of like, I don't know, being part of an exclusive club. There was something kind of very containing about being there and all being united and having that commitment. And I think I said when I was talking with Bill and Phil that everybody that came to working in the field had an absolute commitment. And you were there because you really believed that something needed to be done. We needed to stand alongside people. And so that's a pretty unique situation, I think, in terms of a workplace. that we all had that very strong commitment. And sometimes you could bash up against people because, you know, the level of the values around the commitments were slightly different, but by and large, people were there because they wanted to be there. And I think it was kind of just known. Maureen, what do you think?
I'm seeing head shaking from both nurses, either Liz or Maureen. Did you want to chime in on that?
Yeah,
definitely. People chose, or do choose still now, to stay in this sector, and it's really nothing like the typical sort of patriarchal, male-dominated workplace. You know, it's you'll see it amongst the infectious disease doctors. You know, it's nowhere near like a normal hierarchical sort of attitude to patients and everything. Edwina, forgive me if I say that, but it's just vastly different to what you see in other areas. And so I think as a woman in this sector, it's been you just feel part of it, and everybody's basically chosen to be there for the same sort of reasons.
I think I remember when I was a medical student, I remember thinking I might end up being a gynecologist, and somebody said, oh, that would be a real shame because you'd never get to look after men. And then I go on to become an HIV specialist in Australia, where, you know, gay men, preponderance of people burdened with this rotten virus, and I hardly ever look after women. So it was a funny thing. But actually picking up on Liz's, the theme of, well, the reality of the way patriarchy weaves itself in our lives, I think I capitalized on, I was lucky because I could capitalize on the patriarchal view that it's a woman who can be more tender or more caring. And so I had permission by nature of my sex, I guess, to be a more hands-on, caring person that perhaps, hopefully, a lot of them felt comfortable in being, they allowed themselves to be looked after. And here, while I'm talking to you, I'm really thinking about Ward 4, Fairfield Hospital, you know, 1990, in the early 1990s, where they just let you look after them. And or perhaps if once they were discharged, you saw them in the outpatient clinic, and I don't know, you could just be more tender and more human and see them holistically. So I don't think that if I were a young man, even if I had the desire to be like that, I think I would have probably had to suppress a lot of it. So I think I used patriarchy to my advantage there. It was great. And I really enjoy being able to express myself in that manner with people, with patients.
Well, with I mean, even in the early days, the women's health movement, they didn't have HIV as a women's health issue until 1992, after quite a bit of lobbying on our part. But within the women's health movement, they'd say, oh, they're those other women, they're not us, they're those other women. And it wasn't until 1992 that they actually wrote in their strategy that HIV was a health issue for women, not just other women.
Maureen, did you have anything to add to that? I realized we didn't throw to you for that at all.
Oh, no, that's okay. I think we've said enough. Yeah.
Look, I am mindful. We actually did get one question specifically for you, Maureen, so I'll throw that to you now. Someone asked, how many people have you had to give a positive diagnosis to over the many years of your professional life? And it was someone who's clearly familiar with your work here, because they said probably more than just about anyone else in Victoria, I would think. You are a bit of a wonder. So how would you answer that, or how would you respond to that?
Well, I think, one, I don't have a number, but I think that our process in the beginning was that the doctor and I worked together, and we had that was clear, was thought through very carefully about how we would go about giving positive results, knowing how, you know, especially in the early days, how terrifying that would be, and So we worked very much as a team, the doctor and myself, and we had a clear process of what would happen and how people would be supported. And so that's how it worked. It wasn't just me, I can tell you, but it was really in the very beginning. And I saw a lot of very young gay men, you know, speaking with them about their positive diagnosis and what it meant and what they needed to do and how to help them understand their own feelings and you know, and their partners often. Sometimes we got to speak to the parents. And so one of the things that stood out for me, I have to say, is often a young man would have to tell his family that he's HIV positive and he's gay all at the same time. And so we did do some early family work, you know, working with the families if they were willing to participate in that. But in the beginning, it just seemed so many young people, not only young people, but to me, I suppose the younger men stood out because they were sort of still exploring what it meant to be gay often, and their relationships with their families and their friends and their careers and things like that. And then, you know, you tell them this awful news, which it was back then, awful, devastating in many cases. So I don't know if that answers the person who asked the question, but it's, you know, it was pretty awful. It's not strong enough a word, but it was pretty awful in the beginning.
Maureen, can I ask you, so what did you do after you'd done that? I mean, this is before I knew you. What would you do did you debrief?
Did I
you have,
debrief?
yeah, after like, that's kind of
in a very informal way. Yeah. But I think I was a bit surprised when you asked me that, and that sort of answers the question, I suppose. Yeah, it being at that time, there weren't other nurses around or things like that. So I relied very heavily on people like Bill O'Loughlin and other people, yourself, Sue, you know, to talk about it. But you just, you know, there was so much on so many fronts that were happening at the time that you just kept one after the other, just kept going.
Yeah.
And there wasn't any formal, you know, debriefing or, and I think now we do it after everything that happens. There's a formal debriefing and blah, blah, blah. But back then, you just kept going. I don't know. It was how it was. What you were dealing with. And I'd been an ICU nurse, so I sort of saw it being like being in an intensive care unit, but for different reasons. And you learn through nursing. I did. You just kept going.
Yeah.
That's a great question, though, around, I guess, self-care in the face of a really trying time. Any other reflections from the group on that?
No.
We used to go to the pub a bit.
Yeah. Go on.
McCrosson's or something.
I just wanted to say funerals, of which there were many, you got to the point where you had to pick and choose, you know, like you couldn't go to a funeral every week. And I, you know, I made a lot of gay male friends, and but also when a group of us women would go to positive women's funeral, we'd be hovering up the back and people be looking for, who are these people, down there, this group down there. And the minister would be talking about someone that we didn't know at all, really. I mean, we did know them, but not in their context. And the thing about, well, they died of cancer, and there's cancer envelopes outside for you to put money towards cancer and things like that. And that was really very, very sad and heartbreaking, really.
Did anyone else want to chime in on there about I guess, kind of looking after yourselves, either Liz or Edwina? Any thoughts on that in the face of, some difficult work, to say the least?
Only to say that I think it just really wasn't formally really addressed. We weren't trained to think that way. It was all outward going, the care. You were primed for outward care delivery. It wasn't a model that you should have inward incoming care delivery. So
Yeah.
I think you could get a bit knocked about, and as soon as you added in something like personal issues and personal challenges in your world plus work, then yeah. And of course, you never discuss that with your patients and rarely with your colleagues. So you can get badly squeezed in those days. Yeah.
I guess that was going to be one other. Oh, sorry. Go ahead. You go ahead, Liz.
I was just going to say Beth Hatch that someone mentioned earlier and Tom Carter, the two contact tracers, they set up the group that was called ANRAG, AIDS Nurses Resource Group, and then now it's sort of morphed into the ANZANAC, which is the group that I'm in now, Australia New Zealand Association of Nurses in HIV Care. They set that group up to support nurses I think it was in 85 they first set it up. And that sort of continued, but it was really more informal, but education sessions and a support group for nurses. So that's been really good over the years.
One of the things that I guess that came out of what you were just saying there, I guess, around that that balancing, I guess, your lives, is that, as while you're responding to this, and this is a really detrimental thing, you do have your personal lives, and sometimes those personal lives can be quite, I guess, external to this, because you're not necessarily, your personal lives aren't necessarily directly connected to what's happening in the gay community during this time. Edwina, you've sort of said it there very briefly to say that you can be pretty well squeezed, but was that a challenge for everyone else as well? Balancing sort of, I guess, would it have seemed like two different worlds?
No, I'm really lucky. I've got a wonderful partner, and I could talk to him about stuff. So, and I think we were renovating a house and wrangling two adolescent boys. So, that was what was going on out there. So there was a sort of a divide, if you like, that was good. And I did a lot of gardening, and as did Bill. Bill would sort of do a lot of gardening. So yeah, that was my kind of refuge, which, for people like Bev, people who are living it every day, but I could actually was able to escape to some degree. But also I think that I was a bit older, and because I'd worked with people with cancer, even though it was different, it was hard, but I never felt that there was anything. What I could do was I could provide services, I could listen, I could do all of those sorts of things, but I couldn't change the ultimate outcome. That wasn't for me to do. And that was a sort of protective thing in a way.
Yes, I way back before I was HIV, I went and did a month's meditation course in Nepal, and we had a lot of teachings on death and dying. Death is definite, the time is indefinite. So I think that helped was good stead for me when I was diagnosed, that I'd had those teachings. But I also went to see a Lama soon after I was diagnosed and said, you know, I've become HIV positive, and I was feeling very sorry for myself at the time. And he said, well, you've been given this gift. You've been given this gift to help others and support others, and, you know, and it just turned me totally around, you know, to stop thinking about me and thinking about others and how we can support each other through this crisis. Yeah.
Mm.
That's wonderful and amazing. Also, that you went to Nepal at that time to have that. It's very opportune, I suppose. We did actually have a comment here, Bev, as well, that I believe it is from Heather Ellis over at Positive Women Victoria, who has mentioned that they have a video telling a bit more of your story. So we'll definitely link to that after tonight's event as well for anybody that's interested. Because it does sound like a pretty remarkable one to hear. And of course, just a precursor to the memoirs that we'll have released by you in the near future. I'm going to throw one more question out there if we don't get any more in the chat. But you know, every so often we see new depictions of the HIV and AIDS epidemic. Probably most recently, the series "It's a Sin." And I know I've spoken to you about this before, Sue. But I guess for the broader, you know, when you see these depictions of the epidemic in TV and movies, are there any that you think are particularly good portrayals, or that have totally missed the mark, or even if you just want to make a general comment on what it's like to watch those, having lived through it yourself?
I think the best thing is to see, you know, women's stories, men's stories, people's testimonials, and, you know, there's a lot out there these days that you can, and I think that's a great learning tool to, to learn about other people's experiences of living with HIV. Really important. I did like Holding the Man, though. I thought that was
Yeah.
yeah. And it was interesting because when Positive Women were based at the Alfred in Fairfield House, we were opposite Wesley. And the principal there, I won't mention his name, the principal there was absolutely outraged that Positive Women's office was just across the road. And that they might try and sell drugs to their students or whatever, sell their bodies to the students. So we had to really fight with them. Well, not fight with them, but, discuss with them, that they had it totally wrong. And it was, it's more like the Wesley boys would have been doing whatever than what they...
Their headmaster, Jesus, what a pain.
Any other thoughts on when you watch of the epidemic, or do you watch them? I suppose.
Not for a long time. I think Holding the Man, and also there's one called Walking on Water, which was pretty disturbing. It was about someone with HIV, but it was about euthanasia. And that was a pretty disturbing little watch. And it showed that there was a family that were caring, but this young man had been living with his partner in a communal house. Has anybody seen it with Vince Colosimo? Haven't seen it. It's pretty amazing, but it showed a family that was trying to do the best that they could, but they hadn't been around. And when it came to the end, it just made it all very awkward for everybody. And it was just a very difficult time because, and it's that stuff, I think, of the gay men, and a lot of people have a family of choice because things are not so good with their family of origin. And it really portrayed that very well. But I like the idea of people, remember when all of a sudden oral history was the go, people would go around and interview old people. And that's, I think that's a really interesting thing to do, to talk about people, what happened, the various stages of what you went through is interesting to hear people's stories. It's wonderful hearing other people's stories about their lives, and and I think the other thing, which is completely out of the blue, it was wonderful when we actually had PLWA, and David Menadue, I think, was the first person. We actually had somebody that was prepared to say, I'll go and talk to somebody who's newly diagnosed, because he made an enormous difference to people. Being able to talk to somebody who's actually living with HIV made because we could tell them what they might expect, but it's so different talking to somebody who's been there, who's had some, has gone a long way along. And that made an enormous difference. And it was, I think I was at the Alfred when it first was happening. And it was just great that I could ring David and say, I've got someone, can you see them? And he would say, yeah, Ben, fantastic. And that made an enormous difference. And I think that it's that personal story. Films are all very well, but I do think, like Bev says, personal stories are kind of more interesting, because they're all different. We're all different. We've all got different stories to tell.
Maureen, Liz, Edwina, any final thoughts on depictions in TV and movies?
Oh, look, I'd have to say, Caleb, I pretty much avoid them. I do agree Holding the Man was a very poignant portrayal of what was going on. But I think it touches on sadness for me, and I think there's only so much of it you can bear. So, I tend to give any of those things a wide berth, I have to say.
Fair enough.
I know
Liz or
there's
Edwina?
there's one called 5B about the ward at San Francisco Hospital, but I haven't seen that yet. But apparently that's very good.
5B.
5B.
I'm
Yeah, I
bit
haven't quite.
more. Oh, sorry, Liz. Beg your pardon.
No, similarly, I just haven't sort of had the heart to go and watch it. But yeah.
Do you know, I Googled earlier today Holding the Man, because I saw Caleb's question, and it was described as a romantic drama. And I was really taken aback that anybody writing about film, they were writing about, could describe something about with that kind of subject as a romantic drama. And I really was taken aback that it would be described that way.
Yeah, not tragedy.
No, that's how I would describe it. Yeah.
I'm like you, Liz and Maureen. I find it extremely painful watching those films. I don't know why. Like, it's so painful. And I have seen Holding the Man, and also I did watch the series It's a Sin recently on someone's recommendation, and actually that was also really sad to see this gorgeous, wonderful, and it was really largely about gay men coming out in difficult circumstances with challenging families, including sort of non-English speaking or overseas born families living in London, and incredible stigma. And they just totally were embracing their sexuality, their sex drive, all that aspects of that energy, that human or animal procreative energy is so amazing, and it was great to watch it, just to be reminded of how humans can be that embracing of sex and desire. It's so taboo now in so many ways, so incredibly taboo. And we touched on U equals U earlier, which has allowed people on treatment, successful treatment, to live lives where they can't transmit the virus, and hopefully they are imbued with a greater sense of being able to live through that type of self-expression through sexual expression. So I'm glad I watched it from that point of view, at least, just to be reminded of how people can be. But there were some critiques of that, just in respect to the purpose of this talk tonight, that there was a wonderful woman who played a pivotal role in supporting her gay male friends who got HIV in that series. And I think they felt that the voice, critics thought that it was very much a sort of a patriarchal approach to women as helpers only. But the woman was an activist, and a lot of women were activists and at that time, and women played key roles. All of my colleagues and friends here did that. So there was still some critiquing of that, and it's just coming back to patriarchy will sneak in every little crack that it can, even if you're trying to do something really honorable and trying to break down stigma in one area, patriarchy will still weave its way in, and you'll get affected. So it was an interesting experience, but it's nice the fact that we have all been involved with a pandemic that what is transmitted largely sexually or through injecting, which is also a fairly intimate thing to be doing to yourself or with other people. It's pretty amazing what we've learnt and experienced through that, and taboos that keep being challenged. We haven't finished that job. We've got to hang around a bit longer and do that.
Well, just being mindful of time, one thing that I will just add to that is that whilst I fully appreciate that, it's probably difficult to watch some of those portrayals when they do come up, we did see a big interest in the community, especially younger generations that have no lived experience really with this epidemic, that it triggers their interest and their curiosity. And does lead to us setting up conversations like the one we're having tonight. But with that in mind, I want to thank all of you, Dr. Edwina Wright, Liz Crock, Bev Greet, Sue Stone, and Maureen O'Brien, for joining us and for sharing your stories. And I encourage Bev, keep that memoir going, and please to the rest of you as well, please write these things down, because we do need to keep those reminders. And it's great to hear 5 amazing women's stories tonight. We've had some great comments come through already. Just a few people have said this session has been amazing, delivered by some amazing women, and some thank you all. Thank yous are now rolling in through the chat. So again, thank you to all 4 of you for joining us tonight. It's been an honor to facilitate, and I'm so glad you could all be here.
Thank you
Thank
for the
you.
opportunity.
Fantastic.
Thanks
for the opportunity.
Thank
Yeah.
you.
Thanks everyone for coming.
Cheers. Thanks very much. Have a great night.